What if we could stop the transmission of HIV? A world without HIV is possible. Every year, over 1 million people are newly infected with HIV. In 2017, there were about 37 million people living with HIV/AIDS in the world, of whom only 22 million, or 59%, are on HIV treatment, also known as antiretroviral therapy, or ART. HIV medicines or ART therapy is so effective at decreasing the amount of HIV virus in the body that it is very unlikely for someone who is on these drugs to transmit the virus to their sexual or injecting drug partners or to their infant children at birth or through breastfeeding. Getting HIV-positive people on ART is currently the most effective way to stop transmission of the virus. In order to end the HIV epidemic, people who are HIV infected need to get tested and on treatment as quickly as possible. This helps them to stay healthy and prevents transmission of the virus to others. We have a new tool that can help us end the HIV epidemic. It is a rapid test for recent infection that can be completed in 20 minutes at the same time a person is tested for HIV. This new rapid test for recent infection can help us know if a person's HIV infection is recent, which means that they were likely infected within the last 12 months, or long-term, which means the infection happened more than 12 months ago. New HIV cases are often found within networks of other people who are HIV positive. When a person is first diagnosed with HIV, it is important to identify their sexual contacts and/or injecting drug use partners to look for others who may be infected. This person may have acquired HIV from one of their sexual and/or injecting drug use contacts or partners and may have transmitted it to someone else. The process of identifying the sexual and/or injecting drug use contacts of people who are HIV positive is called index testing. Index testing is especially important for people who have been infected with HIV recently, within the last 12 months, because it is more likely that they have contacts who have HIV and need treatment, or who may be at higher risk for HIV infection. There is a new initiative called Tracking with Recency Assays to Control the Epidemic, or TRACE. TRACE is currently working to expand the use of rapid tests for recent infection, or rapid recency assays, in many countries. TRACE aims to identify people who have been recently infected with HIV and to respond in a way that will help us rapidly identify other people who are infected and get those people on treatment. This may also help us to identify individuals who do not have HIV but who may be at high risk and provide them with HIV prevention tools, such as pre-exposure prophylaxis or PrEP, to keep them from getting infected. Data on recent HIV infections can also be used by ministries of health to identify hotspots associated with recent HIV transmission. These data can be used to enhance prevention interventions, to improve case finding, and prevent transmission to HIV-negative sexual and/or injecting drug use contacts. To learn more, visit our website at trace-recency.org.